Hey, good morning. Welcome to Your Personal Health. My name is Jeff Harrison. Sorry, we're a little bit late. There was some announcements made over on the COVID-19 update that took a little longer than we anticipated, but Dr. Burris and Dr. Kim are showing up. We've been talking this month in October on Your Personal Health about sleep, because sleep is such an aid when it comes to us getting or allowing our body to repair and recover and all types of things, not just about so we're not yawning at 3 o'clock in the afternoon, but really so our cell structure and things of that nature at a level that's going on unconsciously are helping us renew things, stay healthy, immune system, all that stuff that's important. That happens while we sleep. So this month, Dr. Burson and Dr. Kim have dedicated the month of October to sleep. And the first week they talked about, hey, why aren't we getting good sleep? And then what are the culprits of it? And what are the things that we need to do to get good sleep? Today we're going to wrap it up really by just kind of giving you a system and kind of walking through. It's a little bit of a review, but it'll also be some new things about, hey, how you can get good sleep. Because we're not talking about somebody who, hey, occasionally you don't get your sleep, but we're talking about somebody who there is a situation where they're not getting sleep and it's starting to stack up. It's not good that you go, 3 hours, 4 hours, 3 hours, 3 hours, and you're not getting enough sleep. So we're talking about those folks that are really kind of having some challenges sleeping. Not that this won't help those people who have an occasional poor night's sleep, but we're more concerned about your health and how it relates to all the parts of your body by just getting good sleep. So I see Dr. Burris and Dr. Kim are in the house. Let me bring them in. Hey, Dr. Kim, Dr. Burris, welcome.
Hi.
Hello.
Let me just change this real quick so it doesn't look so. There we go. So, I know today on your show you announced on the COVID-19 update, and it's really kind of like good news, bad news. The good news is COVID is really, the numbers are down in the low fours. I think here in the Coachella Valley, you said we're right around 4, and the infection rate. And it's time to kind of put that to the side and say, hey, we can start to get back to our lives. But at the same time, you guys have been doing this for, I don't know, has it been 15 or 16 months?
hmm
Wow. So I know that probably is not sad news that you don't have to talk about COVID every Monday with me or once a week, but we really appreciate all that you've done on that show. You've helped us walk through and work through some times when we're just going, hey, I don't know what's going on with my kids. Can they go to school? Can they not go to school? Should I wear a mask? Should I not wear a mask? Hey, should I get a booster? You answered all those questions. If you're just joining us for the first time and you're not sure what we're talking about, go back to the channel on YouTube and check them out, or on Facebook and check them out. They have every week they've come into your internet and provided us value information and given us a little insight specifically on the Coachella Valley. So I let the people know that we were talking about sleep. And so we're not talking about the people that are just every now and then losing a night's sleep, are we?
Oh, no, that's pretty normal. There are some people who are blessed with continually perfect sleep, but as most of us experience, we often will have a night here or there. We're really talking more about people who are having problems most days and are not waking up rested most days of the week.
Yeah, I mean, there's things in life like if you just had a newborn, you're not going to get perfect sleep, and that's just the season of life. But we're talking about people who aren't intentionally, I got a deadline in the next 2 weeks, so I got a midterm, so I'm cramming. People that are just unable to get good rest, or they think they're getting good rest, but they just seem tired.
Mm-hmm.
Last night, my wife and I we went to the movies for the first time yesterday. We saw that James Bond film, which that'll get your heart pumping. A lot of activity, a lot of action. But then we went out and had a little bite to eat, and it was at a sushi place, and I had hot tea. And Carmen, my wife, says, "Won't that bother you to go to sleep at night?" I'm like, "Nothing bothers me from sleeping," and it had no effect. But yet, sometimes people will have a little bit of that caffeine. This is probably around 7 o'clock at night, and they will have a bad reaction. So Do we start to monitor things like that and be aware of it and say, hey, that's a road I don't want to go down? So I do monitor those kind of things.
I think you probably don't have to worry about it too much unless you're having a problem. As you're finding, you and Carmen have a different experience with caffeine, and that's kind of common. I can actually have caffeine after dinner as well, but Mike can't.
Hmm.
So there's, but I have to be a little cautious about it now, whereas 10 years ago, it didn't bother me at all. So things may change over time. You'll see variability, but I don't think you need to be worrying about it and trying to alter how you're doing things. If you're already sleeping well, you're okay with what you're doing. But if you start to have problems, it's a good place to look at first.
Well, is that a good place to start as we wrap up the end of the month on sleep? Is understand creating a schedule so that there's some consistency in the time you wake up and time to go to bed, or is that really play a factor?
I think that's something that if you're not doing, that if you start doing, then you'll have that many more edges to being able to sleep well and getting a good night's sleep, so that if something intrudes or something changes, you have this set schedule of going to bed at the same time, waking up at the same time, and that way your body, you can set the rhythm of your body and their circadian rhythm, and everything kind of it will be predictable. Versus if it's all over the map, then not only is that going to be unpredictable, you're going to send mixed messages to your body about, like we talked about, messages of it's time to wind down versus messages it's time to actually get up. And if those can be more predictable, then your body will absolutely respond much better.
When you talk about circadian rhythms, first of all, I'd love you to just kind of give us an idea of exactly what that is. Somebody said, "Hey, I've heard about that. I grew up in West Texas. Circadian sounds like those things that are in the trees, and we don't want that going on." And then I want you to, I want to know, can someone's circadian rhythm get off track? And if so, how are there some steps we can get back on track to say, hey, it's night outside, it's dark, I should be getting sleepy, versus it gets dark and I'm wide awake? Is that a problem? How do we get to that? What is it first?
So circadian rhythm is about 17 years long, and they're little bugs, and then they come back up. But a circadian rhythm has to do with the 24-hour period of a day. And that is a rhythm that is very controlled by light input. And when people wake up in the morning and it's light out, that starts that clock ticking, basically, that tells you it's morning. And it signals your brain and your body that it's time to get up. You have actual shifts in hormones all over the place, of hormones that help you kind of get up and move. And when it gets dark, that sort of reverses that process. Things start to kind of slow down. You may find that it's harder for you to concentrate. And you may find that you're starting to yawn or feel sleepy, even if it's only 3 o'clock in the afternoon, but it's dark outside. We've seen a lot of problems for people with circadian rhythms in different scenarios. One is in the extremes of the far north and south, where the daylight hours are either extremely extended or very short, depending on the season. And it can be really difficult for people who live in areas like this, where it's really never dark, to actually go to bed and sleep well. So often you'll find people who live in these areas have like complete blackout on their drapes. Other people for whom circadian rhythms can become a problem are a population that is blind, because they don't have the light input into the brain from their retina. That can actually sort of destabilize their circadian rhythm, and there are ways to actually help them sort of get back on track. And then shift work and jet lag are probably the other big areas where people will notice their circadian rhythm working against them. Your body just tells you, okay, it's time to go to bed, and yet you have things to do, or it's only 1 o'clock in the afternoon because you're in Australia or something. So these are the areas where we start to have problems. But a circadian rhythm is our flow of our wake sleep cycles, and it's around a 24-hour period, and it's controlled by light primarily.
So when you bring that up, I think about when we were on vacation on the coast. We had a lot of cloudy, kind of darker days that we're not used to out here in the Coachella Valley. And I did notice myself, like I'd be sleepy during the day for no reason at all. I'd had a good night's sleep, but I'd be like sleepy during the day. Now I get it, because it was kind of like starting to simulate the end of the day. And my body
Right.
thought, hey, you're supposed to getting sleepy. Works really well that way. Um, the other thing I'm curious about, because I think next week, or the first Sunday in November, I think we still do this in the state of California, where we actually set the time different. We have a time change where I think we lose an hour in November. So does that for the first couple of weeks or so, or for a period of time, is that affecting people and their circadian rhythm?
Yes, and in fact, most people will have a lot more problems in the spring than they do the fall.
Mm.
And the reason is, in the spring, you kind of lose an hour, you leap forward, and in the fall, you fall back. So you have like this extra hour of sleep as the clock adjusts. There's a lot of pros and cons to daylight savings time. But from a health perspective, it's not helpful.
Mm.
Changing that circadian rhythm puts a certain stress on the body, and we can actually calculate the number of heart attacks that are caused by daylight savings time changes.
Wow.
It sounds weird, but it's because that stressor puts somebody who's at high risk for having a heart attack. It kind of just like the straw that breaks the camel's back for that person. And every single year on daylight savings time, there's a spike in the number of heart attacks.
Wow.
In residency, we always actually look forward to losing the hour, because you in the when you spring forward, when you're on call, you're like, "Ooh, it went from 12 to 2. I have 1 hour less of call." And
Yeah.
then when you fall back in the fall,
It's like
you
one
know,
more
one more
extra
extra
hour.
hour that I have to be on call.
Well, another thing I want to ask you is because longevity is a big thing now. It has been for a while, but we're, as even I get older, I think more about longevity. How or what role does sleep play in adding to or subtracting to our longevity, or does it play a role at all?
There is this sort of sweet spot between that 6 to 9 hours, where it looks like if you go below or above that, you actually, it's correlated with a decrease in longevity. So what I mean by that is, people who live longest tend to sleep that 6 to 9 hours per night. Whether that's actually caused by the sleep is a different issue, because you may be sleeping many more hours than that because you're using a substance, or because you're depressed, and other factors may be driving that. Or you might not be sleeping well at all because you're in chronic pain from an underlying health condition that might contribute to a shortened lifespan. So it's difficult to tease apart just the sleep component. But in general, aging brings its own additional sleep challenges, all the way from people having to get up more often to go to the bathroom at night, to issues with depression or anxiety, as well as problems with schedule, chronic pain issues with arthritis. as well as other neurologic conditions like dementia, can really affect your sleep pattern. So it can become quite complex, and it's really important for that person to be working closely with their doctor to try to maximize their sleep, and consider that the medications that they're on also may be affecting their ability to go to sleep or to stay asleep, or the quality of their sleep.
I think that's a good point there about the the difference in the age and then also medication. I know there are a lot of folks out there who are up in years, and I think about my mother-in-law who just moved from North Dakota down to Scottsdale, and now this weekend she'll be moving into an assisted living home. And I'm thinking, you know, there are times I look over when we're visiting her in the middle of the day, and she's nodded off, but she's historically had very poor sleep. And as you mentioned, the thing about all the interaction with her medications, I mean, she has this whole list of medications that she takes. And I wonder, you as a physician, not her physician, I want to make sure you understand that everybody understands that, is how closely do you look at that? And sometimes is it a situation where if you're going to two or three different specialists, is our medical system set up to say, hey, well, I notice you're already on these particular drugs, and I don't want to interact with this other drug, or I want to talk to the other doctor. Is that in play, or do we still have a little bit of a gap in that kind of communication?
I think ideally it is with pharmacists and specialists and primary care. Everyone is, ideally, making sure that there's no big interactions, or that, this won't cause this. But in reality, as this every system, whether it's the pharmacy or the specialist or the primary care doctor, gets the demand of more and more and more production and more seeing more patients, there are things that I would imagine are getting missed. And there, absolutely, that's one of the things that we look at in terms of if you're having poor sleep is what medicines are you on? Are you on too much of it? Even certain medicines that historically don't cause some people to be sleepy can make other people sleepy, and vice versa.
Also, supplements.
Yeah.
Often people don't even think to tell their doctor about a supplement they might be taking, but it could either be causing a symptom or interacting with one of their other medicines to cause a side effect. The other thing that can happen is people don't bring up the fact that they're not sleeping well, either because they attribute it to, oh, I just need to fix this thing and I'm sure it'll be fine. But it's worth discussing with your doctor, and finding a doctor that will take the time to sort of work through all the potential things that might be causing the problem. All the way from taking really long naps right before dinner, that could actually disrupt your ability to fall asleep, to a supplement, to something like caffeine intake or stress or an underlying problem, or even just inadequate pain control.
You mentioned something I think that is a real hot button, and I don't mean to plug you and Dr. Kim with Coachella Valley Direct Primary Care, but you said something that I think we're all aware of as patients in the healthcare system as it exists today. Is when we go in to see a doctor, it's almost like we feel blessed that we got 5 minutes with the doctor. Like, oh, he spent a lot of time with us today. But in that conversation, if it really was a conversation, it was, where does it hurt? Here's a prescription potentially, or here's an exercise or physio. Here you go. And then you're out. You do things a little differently. I know that I had the pleasure the other day of coming to your office and actually spending some time. I think we spent almost an hour together, Dr. Kim. And it was just like, it was so refreshing. Is that really a unique thing with you, or is that normal for Coachella Valley Direct Primary Care with their patients to be able to discover those things you just described?
That's our model, is to make sure we're able to take that time when we need to. Not every visit with your doctor really has to be an hour, but occasionally they do. And we wanted to be in a setting where we were able to put that time in and set it aside when it was needed. Because honestly, taking that time at that point actually can prevent problems. And preventing a problem saves everybody time and frustration later on. So sometimes the extra 5 or 10 minutes to sort of delve into a problem is actually a time saver for both the patient and the doctor. So really shifting the point of view of it is better to invest and make sure that we've got the correct picture and that we're heading in the right direction and that we've actually understood the problem in a thorough way, is what makes us different, I think, than a lot of practices. And the only way we could do it was to step out of the insurance model, because the insurance model does not allow it.
Yeah, the insurance model is based around economics. And it's not all bad. Insurance is good. We recommend people to have insurance for specific things, but for it to be the end all and be all of healthcare, it really is driven by economics, which is a numbers game. And so, like Dr. Burris was saying, that we didn't want that anymore, and we have several colleagues that are feeling like it's not enjoyable from the provider point of view as well as the patient's what they're getting. And it was just we were coming home feeling like this was not what we wanted to do, because it was getting just unenjoyable. And when that happens all around, bad outcomes occur. So we decided to jump into direct primary care where we could have that, because just like every business, we need to keep our lights on, but that's not the primary focus. It really is on trying to help people.
Well, I put your information on the screen there. If you don't have a primary care physician, and believe it or not, it has its own pandemic effect right now. There is a very large shortage across the country of people like Dr. Burris and Dr. Kim who have dedicated their career to be primary care physicians. And here's a bonus, if you're here in the Coachella Valley, is the fact that, as I understand it, Dr. Burris is also a pediatrician. So if you're a parent and maybe you just had a newborn and you're like, I don't have a pediatrician. Well, pediatricians are even in a shorter supply, gang. Now you can get a 2-for-1 with the Coachella Valley Primary Care, where you actually have Dr. Burris, who is a pediatrician, and Dr. Burris, and Dr. Kim with the healthcare can take care of you and your whole family. The information is on the screen. You can just call 642-5549, or just go to their website listed there. How big a problem is sleep? Is it really a big problem, or is it something that, it's kind of, we've blown it out of proportion?
I think that I don't have the exact number, but I think for most of us at some point in our life, sleep is going to be an issue. There are very few people who go through their entire lives without having a season at least where either lack of sleep or poor quality of sleep is affecting their daily life. So I would say it's an almost universal problem for people at some point in their lives. And then for another part of our patient population, it's an ongoing problem that they may struggle with off and on for many years.
Yeah, I think it's variable, but I would say it's a key component for people for feeling better and living healthier and being healthier, because it really has to do with function of the brain and muscles and everything restoring itself. And so if that's not occurring at a appropriate level, then it's going to be hard, and it's all interrelated with your nutrition and your stress level and your disease management and what you're putting in, artificial substances or what have you. And so it's all a complex formula that is not the same for everyone. But I do agree. I think, at least in my life, I can't remember when sleep was like, oh, it was perfect, because there's always demands and something being affecting it. And
But often if I find that I'm getting sick or I'm more stressed and having difficulties just kind of getting through the day, the first thing I go to is checking my sleep and maybe getting that part fixed, because that's the foundation that you can build on to fix more activity, better nutrition, working on your overall stress levels. Sleep is the foundation that gives you the tools that you need to tackle those other issues.
hey, just came up with a new word in my brain.
What's that?
Instead of hangry, you're slangry.
Oh, yeah.
I thought I'd better come in and stop that right there in its tracks. Slangry. When it comes to someone having some issues with their sleep, it's like we've become such a specialist world. Who should they turn to first when it comes to, hey, they know they're having some issues with their sleep? What part of the medical field should they go to?
Pharmaceutical? No, kidding. Sorry.
He hasn't had enough sleep.
Yeah, truthfully, you should be starting with your common sense first. If you're drinking 2 to 3 pots of coffee a day, perhaps you should just address that. And so you start with the things that you already know, because a lot of us have the, built-in wisdom. And then if that's not working for you, the next step I would say would be to go to your doctor, because you want to address anything that might be going on in the health realm, maybe a medication problem, or maybe it's a sign that there's something else that needs to be addressed. So if you get through that process, then that usually fixes most of the issues, or at least puts you on the path towards improvement. And then beyond that, there are people who specialize in sleep disorders. So some people have an actual sleep disorder and they can go to a specialist. Usually it's a subspecialty of neurology. There are people with obstructive sleep apnea, and that usually is a subspecialty of pulmonology or lung disease. But truthfully, the best place to start is with your primary care doctor, because they can sort of tease apart where the problem may lie and sort of help you down the path to getting that addressed.
Yeah, no, I would agree. Your primary care doctor has a bunch of tools per se, a screwdriver, a wrench, a hammer. If you go to the subspecialist first, they're just going to have the hammer. They're very good at it, better than me than using a hammer, but that's all they know how to use. So they're going to say, you need a hammer. And if it's not the hammer, they're going to say, oh, great, sorry. So I think it does make sense, like she said, to start with your common sense, call your mother first, and then go to your primary care doctor or primary care provider so they can really kind of tease out what might be going on.
I think that makes great sense. Is like you said, you called it teasing out, but it's an opportunity for us to come in to our primary care doctor who, let's face it, you're the ones who should know the overall scope of our health. And then at that point, like you were saying, hey, some should be a pulmonologist, from that field, and another is neurology. I don't think the average person on the street would know that. And as you said, Dr. Kim, if you're a hammer, everything looks like a nail. We want you to look and say, hey, that isn't a nail, it's a screw, and you need something different. I love that example. So on the screen again is information for Coachella Valley Direct Primary Care. They are taking care of you here in the desert. The phone number there is 760-642-5549, or just go to their website at CoachellaValleyDPC.com. Check them out. I really recommend you checking into them. We've been a patient now, or do you call them members? Members for a year now. I think about a year now, maybe a little over a year. And here's the biggest thing: have I gone to you guys like every time something happens, I call you? No, I just know that you're there, and if I do need to reach out, there is a calm effect for that. It's almost like please don't take this wrong, but it's one of those things that's like, I hope I never have to use you, but I know you're in my corner if I do. And it's not like, okay, I can get in 3 weeks. If I'm going to call a doctor, it's not so I can get in 3 weeks from now. It's from I can get in today. And that's what you've done in the past when this whole COVID first thing broke out. And I had to have an emergency test because someone had exposed us to it. So any last thoughts on that? We're wrapping up sleep. I'd really like to put it to bed and make sure that we've covered everything. It sounds like, you've talked about, hey, have a schedule, look at your routine and make sure it fits. If you're taking naps, after dinner or before dinner, probably not a good thing. If you're probably, watching those screens right up to the time you go to sleep and you're having trouble sleeping, could be an effect of that. What about eating, late? Is that a good thing, bad thing, or is that like put a lot of stress on our body and we're sleeping trying to digest all that food? Those are questions you need to ask and take a look at that fall into your schedule. And then there are some things that they both said, that your medications. Are you taking some medications that are actually triggering you to stay up late or having trouble sleeping? I know whenever I see an ad on TV for any kind of pharmaceutical, the list of side effects are so long, I'm thinking maybe I should just deal with it, because it's a little scary. The key is go to your primary care physician first. They're the ones that need to really know about everything that's going on in your life. 760-642-5549. Dr. Burris, Dr. Kim, are you still taking patients? I know right now most primary care physicians and pediatricians are not taking new patients because their caseloads are full. How are you guys looking right now?
We have openings for people, so go ahead and give us a call. We aren't going to have a open panel forever. We do have a number that we cap at, but right now we have a spot for you. So if you need a doctor, give us a call.
Great. Oh, one last thing. If I'm a snowbird coming into town, especially now that I think the Canadians, I saw some geese flying over my house yesterday. I think they're coming south again. They're legal. Do you take care of those people if they're only here for 3 or 4 months, or is it a long-term contract with Coachella Valley Direct Primary Care?
No, absolutely. We have several snowbirds they don't have to be Canadian, they can be from other states. But if you're going to stay probably more than 2, 3, 4 months in a given area, then you probably should have a primary care provider. Especially if you have a medical disease, because you never know what can happen. And time again, we've heard from people who are like, well, I didn't think I needed one, but then this happened and I had to go to the ER and it was a nightmare. And so now we want someone that can help us. Like you said, we don't expect you to ever need the help, but if we do need the help, we know that we can navigate things better, because the ER really is for critical emergencies and not for things that can be taken care of. But the way our system is designed, if you don't have a residence in that area you are, then most likely you don't have a primary care there. So if your primary care is in a different state, they can't practice in California or a different country. So we absolutely have memberships designed for people who don't live here full time.
And before we go, I'm just going to put on the screen, because it is so inexpensive, your services that we offer. And I just want to clear this up, because if you're 0 to 45, it's $99 a month. And then after age 46, it's $145 a month. But now, are there any additional fees included in that? I mean, are there office visit fees and things of that nature?
No, that covers our costs, or the cost to use the clinic. It covers no matter how many visits, phone visits. There's no added fees for those. There are a couple add-on things that we pass along at our cost, basically. And that would be if somebody was needing services outside of our abilities. So if they needed to go get an x-ray or CT scan, we would either utilize their insurance or help negotiate a reasonable price for them. So because that's not a service we provide, that's where an added cost will come in. But for our services, that's covered.
That's great. Guys, I can't thank you enough for all the time that you spend on the show. And I know you'd mentioned that the COVID-19 update is over. And, still, as Dr. Kim said, hey, keep that Swiss cheese in model, keep your spacing, wear your mask appropriately, keep yourself safe, and let's keep pushing this top down. We're down around 4% right now. And I just want to thank you both for everything that you do. Check them out. Coachella Valley Direct Primary Care. If you don't have a doctor or you're here for a short period of time, 3 to 6 months, and you're going to enjoy the spectacular weather for the next 3 to 6 months, and you don't really want to go to the ER, I'm certain they will take you and help you out through that time. It's just, as I said, it's nice to know in case I know who to call. That's 760-642-5549, Coachella Valley Primary Care, located just off of Bob Hope in Rancho Mirage, conveniently located near the casino. In case you're down there, you can break away, pay a few hands, and then come see them, and they'll take care of you and get you right back on track. Guys, thank you so much. We'll see you next week. And if you have any questions about the sleep, make sure you put them in the comment section. Dr. Burris, Dr. Kim will answer those. And if it gets beyond that, give them a call, and let's get you sleeping at night. Thank you, guys. Take care.